Hey guys, welcome to Dr. Aunties. I'm Nithya.
And I'm Sonal. Hi, good morning. Actually, it is morning, so I don't know when you guys are watching this, but good morning.
So today we're going to talk about the FDA recall on several formulas that went out recently. And the formulas were contaminated with, it looks like, two different bacteria. So there were three cases of Chronobacter and then one of Salmonella, and one infant died. And so that's why the recall was put in place, was because of those contaminants, so that they can find out what's happening and fix that problem. So with the Chronobacter, that's actually a known contaminant of powdered formulas. And it's because of these recent cases of illnesses that they've implemented that recall. And the CDC actually has a page on their website where you can go to see how to prepare your formula to hopefully reduce the risk of having that Chronobacter in there. Hopefully they're going to fix the problem, but just in case, it's important to follow those steps on the website, and we'll link that in the bottom. And then it also has information about, for very early babies, like preemie babies or very young babies, sometimes it may be beneficial to do liquid formula instead of the powdered one because of that risk of bacterial contamination. And then, Sonal, I know you work with NICU babies. What is your experience with them, or what do you all do to kind of help prevent or reduce those risks of bacterial contamination?
Yeah, I think however the CDC outlines are that we really diligently follow. And one thing that I think the NICU does well that I actually read this article and I'll get to that in a second is the education behind how to prepare formula and how to handle it. And I don't think a lot of people know that. I mean, people don't know that when you open a can of formula, it really is 30 days and then it's expired. So
Mm-hmm.
I always encourage people to take a magic mark or a Sharpie, permanent marker, and write on the label or write on the lid the day they opened it. So I think with all of this is also the lack of education that
Mm-hmm.
we don't treat formula with that much education that we should be.
Right.
So I wrote an article. It was on Kevin MD, and then Kevin MD put it on his Facebook page, and there were so many comments. And literally, the article was basically, to summarize it, is I had to supplement. So, and I know, like with the recalls and stuff, and every pediatrician or every resident who's gone through the ped side has seen one baby come through because of consequences of not mixing the formula right. That's another whole thing, right? That's a whole nother gamut of if you don't mix it properly, you might get electrolytes imbalance and everything. And my whole purpose of that article was that we really should treat formula as quote unquote like a medicine, that you need to know the risks and benefits of it and you need to know how the directions are properly to prepare it. And there was no way saying that formula should be like a prescription or anything like that. It was just that we need better education. And if we had the mindset about treating it like you take baby aspirin, right? There's all these little things on baby aspirin that you kind of go through, and you go through the different, like if you're on different medications, which one it would go and which one it wouldn't, then it's the same thing. And I think that's why the NICU, we don't see it as often because of we are
Mm-hmm.
so diligent about preparing it, educating the parents about it, teaching them that, like every NICU baby goes home on some sort of supplement of how you actually prepare it at home versus, and where you should have a designated area that's always clean. So I think that's a little bit of the difference. I think there's a lot more education that needs to happen around formula.
For sure, for sure. And I think the CDC link we're going to share will hopefully help you see how to prepare it. And the keys are making sure don't use it if it's expired. And like Sonu said, you need to use it within the time frame it says. So if it says use within 30 days of opening, use it within 30 days of opening. And then the other important thing is that you do need to boil the water, especially for those younger infants. And then let it cool a little bit and then mix the powder into it. The reason being is you don't want any contaminants getting in there either, right? So that boiling step, I think, especially more experienced parents sometimes will skip the boiling step, but for younger infants and premature infants, it is an important step. And then the other thing is formula use guidelines are pretty specific and they're very different than breast milk use guidelines. So with formula, once you start the feed, you want to use it within an hour. And then if you pre-mix it, you want to keep it refrigerated for 24 hours. And the reason for that is because there are not immune components in formula that can help prevent bacterial growth. So then bacterial growth will start occurring once that formula is mixed up. So, I think those are some of the highlights from the CDC website on how to prepare and use powdered formula. And then the other thing is, of course, check those any tins that you have at home and make sure they're not one of the recalled tins. And then if it is, some of the tips I saw people suggesting is if you purchased it from a local store, you can go back and see if they'll exchange it out. And then we'll share an article as well from the FDA as far as what's going on with the recall and all of that as well. So you can read more on that piece.
Well, that's what we used to tell our NICU families, to do it for 24 hours. And you put it in the fridge and then you reheat it just the way you would reheat breast milk, where you would actually make a water bath. And so that means that, you boil water and then you put the actual bottle in the the container, and so just let it kind of come to room temperature. But that was the things. But yeah, I think it's just so much out there with formula. I was actually just went to Target the other day, and
Mm-hmm.
I was overwhelmed with the content of it. Cow's milk versus
Mm-hmm.
goat's milk versus now there's all these European formulas are coming into the market, and it's so confusing, within even just the big brands. Like if you look at the big brands are usually Infamil and Similac, and why we're so used to that is because those companies will get the state contract. And so every 5 years, the state will contract with one of the companies. And so then the hospitals are used to giving those recommendations because the formula is very available, easy access if needed. But when you go as like a first time parent, or even like me, who deals with formula and stuff like that, I'm like, there's so much out there. I don't know, like, and they're advertising like this is DHA, this is going to be good for your brain, and and it's overwhelming. I think we should just do like we should go out and like really go to Target and just be like, look at all of this. Like it's so confusing to parents. Like what to get, and is it organic? I mean, like it's just all these buzzwords, and you're just like, and the thing is, the more the buzzword, the more expensive it is, and so that's kind of cost prohibitive, and then you feel like a bad parent, but you just don't know the education behind it. You just don't know that, yeah, like the Costco brand might be fine. Like it's okay to have that. So yeah.
And Jessica Madden, she's a neonatologist who does similar things to what we're doing. And she and I did an Instagram live a little while ago, and I can probably share that in the comments as well. But she went through kind of like all of this information about formula because that's something she does. She does formula consults, and I think she really knows the information out there pretty well. And she was saying there's like all these additives that they're adding in, but at the end of the day, you don't need most of them. They don't really have a lot of data behind them. But she did a really nice job of outlining what are the different formulas, what are the indications when you might need a special formula. So for instance, if your child has cow milk protein allergy, they might need a specific formula that's not made with cow's milk. And then there's different options for that. So she goes into that in really nice detail. So I'll share that. It's a longer video, but if that's something, if you're trying to figure out what formula to use and you need to use formula, then that video might be helpful just to see, so you can see what's out there and try to make sense of all of the confusing things that are on the shelf. Because I agree with you, Sonal, you go in that aisle and it's overwhelming, man. It's like you see so many different things. You're like, what do I need to get my baby? Like what's the best one? And usually just the standard basic formula, like whatever is there is fine. Like whatever is most affordable for your family is probably fine. Like a lot of the additives really don't have much evidence behind them. So so sorry, we kind of got into a larger topic than just the recall, but I think it's important. I think it's important information for families to have. and kind of understand that there are risks to using it. And of course, there are benefits. And, to some extent, you need to consider all that when choosing how to feed your infant. So, yeah, so I'm glad that we're able to touch on this today, and glad that we're able to talk about, the safety aspect of it as well, and the preparation as well as with this recall.
Yeah. And I think the three key things that I know parents just don't know is the expiration. All of them have expiration. Like I said, just take a Sharpie and put the date on the lid so you don't have to remember, or on the back or the bottom of the can. And number two, preparation, like how you're supposed to prepare it. So I went to a home visit where they had there's a machine that you can prepare formula with, and the baby wasn't gaining adequate weight, and the mom kept telling me, so like I went like literally 4 days, I went back to back, and I was like, wait a minute, this kid is not gaining the right amount of weight. I was mixing the formula and the machine was malfunctioning. And then when the mom started mixing it herself with the directions, the baby started gaining weight. And this is the type of education that we need to be also including when we're talking to parents. So, yeah.
For sure.
We did kind of diverge, but it's so important. Well, the reason it's so important, if you look at the CDC data about breastfeeding, you see a majority of people are using formula by the time they're 6 months. And
Mm-hmm.
they're not breastfeeding, so I think we need to start having this as our dialogue and allowing parents and educating them in a way that they are, with breastfeeding and formula feeding, or a combination. Like, people don't realize they can do both. And you're like, if you do both, it's even like it's whatever you can do, right? And just to have this conversation also part of our education about feeding your infant. So, yeah.
Well, thank you guys, and like we had mentioned, we'll share those resources in the comment section below. So go ahead and click through any of that if you have more questions, or throw a comment in there if you have any questions about what we're talking about today.
Yeah. Thank you guys. See you next time. Bye.
Bye.